Welcome, everybody. I want to welcome our distinguished guests and visitors. I, in particular, want to welcome our two visitors from overseas, Professors Morris and Quackenbush, who have travelled a long way to be with us for this important launch. And before I acknowledge and welcome the Minister, I do want to acknowledge the traditional owners of the land here, the Gadigal people of the Eora Nation, and their elders past and present, who have been the custodians of this land. There is an apology from our Vice-Chancellor, Professor Ian Jacobs, who is currently overseas. I think he's in South America on U21 business. But the senior ranks of the university are being represented by Mr. Peter Noble, who is one of the senior vice presidents of the university. So with that, I want to introduce our Health Minister, Jillian Skinner, who I think all of you know, and I just want to say that I guess I've worked with her in one shape or form as Shadow Minister or as Minister over the 10 years I've been Dean. And I'd have to say I've worked with many health ministers, but I've never worked with one who actually lives, breathes and is so passionate about her portfolio, both health and the medical research dimension. So thank you.
Thank you very much, Peter. May I also start by acknowledging the traditional custodians of the land upon which we meet and pay my respect to elders past and present. From the University of New South Wales, I wish to acknowledge Peter Noble, Professor Smith, Louisa Jorm, the director of this centre, the Centre for Big Data Research, and Professor John Mattick. Are you here, John? Not yet, from the Garvan, but Dr. Mary Foley is coming, the Secretary from New South Wales Health, there I see, and Paul Madden, Deputy Secretary, Department of Health, and a particular welcome to our two international visitors who will be, or I think there might be more than two, but our keynote speakers who are here today, Professor Andrew Morris and Professor John Quackenbush. Welcome. I hope the weather holds up for you and that you get a lot out of your visit. To all of you, all distinguished guests, academics, researchers, ladies and gentlemen, Peter is absolutely right. I am a health tragic. I do sleep, breathe and eat it. I wake up first thing in the morning thinking what wonderful new thing is going to happen today. And increasingly it does. I mean, sometimes terrible things happen as well. Watch this space. But look, you know, the wonderful outweigh the negative greatly. And I'm just inspired by the fantastic body of research in health and medical research that actually drives new models of care, new understanding of the way we provide treatments and so on. And I think this topic that you're here to discuss today is absolutely at the forefront. So I'm really delighted to join you to launch the University of New South Wales, Australia's Centre for Big Data Research in Health. The amount of data captured, stored and processed in the modern healthcare system really is astounding. It's amazing. Journalists ask me about data and everything as if I've got it all at my fingertips. It's just amazing the amount that we have there. And indeed, the future of healthcare is one where... Did I do something to the thing? I use a iPad, so sometimes it stuffs everything up, including me. Indeed, the future of healthcare is one where big data plays a vital role and where the opportunity is limited only by our ability to understand and harness that data and translate the evidence into driving better outcomes for our patients. You know, this morning I was talking at launching a seminar looking at cancer and new applications driven from understanding research. International and Australian usage on big data is absolutely growing. And together with our international counterparts around the world, we recognise the value of big data in health. The UK recently established £34 million research network to promote linked data research. And here in Australia, governments have invested over $76 million on the Population Health Research Network, PHRN, to provide a national infrastructure for health data linkage to research, which is beginning to be operational. Professor Louisa Jorm would know this well, as she was the director of the New South Wales node of the PHRN, but more on Louisa a little bit later. In New South Wales, an additional $159 million has been committed to health and medical research initiatives by the government over the last 4 years. And our commitment made just before the March election brings investment in medical research to over $1 billion over this term. This includes the $24 million over 4-year grant provided to support the Sydney Genomics Collaborative, a partnership with the Garvan Institute to establish New South Wales as a leader in genomic medicine. It is a personal passion of mine, this project. I get absolutely inspired every time I go there and talk with John Mattick, the scientists, researchers there, have a look at the equipment that is now placed there. But importantly, now it is a collaborative which is stretching out across other institutes, universities, public health facilities and clinicians. And I've met some of the patients and their families who will benefit from some of the early grants that have been rolled out to allow people to use the marvellous equipment that has been located at the Garvan. So each of the genome sequences used in the program is capable of generating up to 1.8 terabytes of data every 3 days, which is sufficient to sequence at least 15 whole human genomes. New South Wales Health usage of big data is incredible. We've invested heavily in big data to the extent that it's now fundamental to the operation of the Ministry of Health. We recognise that big data is a cost-effective way to build the evidence base around patient treatments, outcomes, hospital performance, health indicators, preventive programs, and what works in health. So that's why I say to people, don't ever think just because there is now an Assistant Minister for Health who has medical research in her title, that means I'm not going to have an overarching view of medical research, because it is what drives everything that we do in our health system. The New South Wales Government is providing record investment in technology in health over the next 10 years, including upgrading our electronic health records, $48 million to expand rural e-health, and $4.9 million to roll out HealthyNet that connects hospitals, GPs and community providers. These are all very important investments. And the work will be guided by the development of a new New South Wales Health e-health strategic plan. New South Wales Health has an internationally significant data linkage capability with a dedicated Centre for Health Record Linkage, Cheryl. I know that Professor Jorm is a big user and supporter of the services of Cheryl to drive her policy-relevant research. Indeed, Louisa led the initial establishment of the Cheryl in 2006. It has linked over 120 different data sets on request, sourced from government, non-government and research sectors. And it's developed a person and family-based data linkage system that contains over 102 million records from 18 frequently requested data sets in New South Wales and the ACT. So it's mind-blowing, isn't it, the amount of data we're talking about and the number of people that it affects. It's been used by over 1,150 investigators to date, and the research use has attracted more than $60 million to New South Wales, so it's a very good investment as well. Cheryl has been identified under the New South Wales ICT strategy as a centre of excellence for data linkage and is formally part of Australia's first national data linkage network supported by every state and territory. We have recognised that to deliver high quality and timely research, we have needed to invest in our data assets, and this is now happening throughout the health system. It is also equally important then that we invest in our human assets, our analysts, our researchers, our clinicians, so that they can take full advantage of the increasingly rich source of health data. The Ministry runs the New South Wales Biostatistical Officer Training Program together with the Biostatistical Collaboration of Australia, which has now seen 45 highly specialised biostatisticians, that's a hard word, released into the wild throughout New South Wales in both the research and government sector. I think they do need to go out into the wild. Training in genomics is also being funded through Intersect Australia, which has seen 103 researchers, clinicians and health practitioners attend its first year of operation. But this is just the beginning, and this is where the Centre for Big Data Research will come into its own. University of New South Wales Australia's Centre for Big Data Research is truly a very important facility. It will serve as an Australian hub, a hub for specialists in epidemiology, biostatistics and bioinformatics, a hub for the sharing of technical expertise in data management, study design and ethical, legal and policy frameworks, a hub for discussion and debate on complex research and the development of plain English briefings and reviews. The Centre aims to improve population health through research using large-scale electronic data that integrates information about biology, clinical care, health services and the social and physical environments. Its research covers a broad range including preventable hospitalisation, maternal and child health, Aboriginal health, chronic disease and multimorbidity and drug safety, just to name a few. In other words, the whole health system. The director of the Centre, Professor Louisa Jorm, would be well known to many of you as one of the principal proponents of health and data linkage research in New South Wales. From 2007 to 2014, she was a Foundation Professor of Population Health and Director of the Centre for Health Research at the University of Western Sydney. She's played an integral part in the establishment of major infrastructure and capacity building for big data research in Australia, including the aforementioned Centre for Health Record Linkage, the 45 and Up study. She led the development of the innovative Secure Unified Research Environment, a good acronym, sure, a new facility that benefits researchers nationally by providing secure remote access to linked health data. In the last 5 years, Professor Jorm has published more than 60 scientific papers, been awarded almost $10 million in research funding and delivered plenary presentations at 5 international and 11 national conferences. So an impressive record. Well done, Louisa, and I think the university is very lucky to have you here. And I want to also talk about, in addition to Professor Jorm, today we're very extremely fortunate to have the two internationally lauded professors at the very pinnacle of their fields. I'm sure they'll get their due introduction, but needless to say, again from me to both Professor John Quackenbush and Professor Andrew Morris, thank you for being here. So in closing, can I say the opportunities stemming from big data are limited only by our skills in analysing and translating this data into better healthcare and outcomes. This is where the Centre for Big Data Research in Health fits in. This is why it will play such a crucial role in this new data-driven era of quality healthcare. We look forward to working with the Centre and are excited for its future, its research, its impact on health service delivery, its impacts on health policy and its improvements to the lives of people in New South Wales and beyond as it blossoms into an internationally renowned centre for excellence in big data health research. Well done, everybody. Thank you.